guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, physician assistant, and former CMP examiner. So today I wanted to discuss fibromyalgia as it relates to VA disability. Fibromyalgia is a very tricky condition that is sometimes hard to pin down as a diagnosis because there aren't, and we're going to talk more about this, there are not like really laboratory or x-ray or any type of diagnostic studies that really pinpoint the condition. And it's usually based on a constellation of symptoms that your medical provider will rule out, other illnesses, and look at those constellation of symptoms and diagnose you based on that criteria, right? So what is fibromyalgia, right? So fibromyalgia, I'm looking at the American College of Rheumatology's website right now, which you guys can look at. So this is a condition that often falls under the umbrella of rheumatology, right? It's not necessarily, it doesn't have to be diagnosed by a rheumatologist. This is a diagnosis that can be rendered or given in primary care, depending on the comfortability of the primary care manager, right? So your nurse practitioner or PA or physician, your family practice doc, internal medicine doc can diagnose this, at the VA or wherever you're seeking treatment. They may not feel comfortable with the diagnosis because, just depending on their comfortability level of what, their experience is, they may refer you to rheumatology for a further workup or eval, or they may just do it themselves, right? But it is certainly something that you can be diagnosed with in that setting. You can also be diagnosed with this at the CMP exam. I don't know that happens super frequently. So if you file a claim for it and you haven't been diagnosed and you go into the CMP exam, the examiner does have the latitude to provide a diagnosis oftentimes for any condition, right? It really is just provider dependent. It's dependent on what the VA requests in the exam. But the provider, when I was a CMP examiner, if I believe someone, for example, had erectile dysfunction based on their history that they were providing to me, if they didn't have a formal diagnosis, but it made sense, I could diagnose them with that at the CMP. Now, don't bank on that happening, but it's possible, right? I had a man tell me today that he was diagnosed with chronic fatigue syndrome at his CMP exam. Flip a coin and hope that your person is, in a good mood that day or they're a nice person. Every provider, it's provider dependent. So again, I would like to disclaim that I'm not an accredited claims agent. I'm not a BSO or an attorney. I don't represent veterans in any type of way, but I do assist with medical evidence for their pursuit of VA disability. So when it comes to fibromyalgia, some fast facts about this that they list are that it affects 2 to 4% of people, women more often than men. It is not an autoimmune or inflammation-based illness, but research suggests that it involves the nervous system. Doctors diagnose fibro based on the patient's relevant symptoms and a number of tender points that they may or may not have. So there's no cure, but there are medications that can reduce the symptoms, right? So it's characterized by widespread pain and tenderness, sensitivity to the touch. The pain and tenderness tend to come and go and move about the body. You can have fatigue, sleep problems, memory loss. And there's some overlap with depression and anxiety, migraine headaches, digestive problems. So, okay, so let's talk about, we talked about what it is. We talked about who diagnoses it. Let's talk about service connection. So you can be service connected for this if you were diagnosed in service. Okay, a lot of veterans can be diagnosed in service with this condition. They can be secondary. I've seen many veterans successful with this as a secondary to their aggravated or caused by their service-connected mental health disorder. It can also be presumptive, right? So it can be presumptive to Gulf War exposure. So Gulf War exposures include anything from, I believe, like 1991 to present. So if you were in the first Gulf War or, in certain areas, Iraq, and there's several others that are listed on va.gov that you can check out. This is often considered one of those non-explainable illnesses that can be rated if it's diagnosed within a specified amount of time to your exposure there, okay? So we kind of talked about some of those things. Let's talk about how it's rated. This is researchable information from 38 Code of Federal Regulation. It's listed as diagnostic code 5025. It goes anywhere from 10 to 40%. So based on the symptoms. So that's pretty much it about fibromyalgia. I'll probably do another video later on down the road that just discusses fibromyalgia as it relates to PTSD, because like I said, I see this one quite frequently. We did a video for all the Gulf War presumptive illnesses that you can check out on the page that kind of goes over more in depth what that's about. You know, I might also do a fibromyalgia video on the CMP exam, but you can go look up the DBQ anytime you'd like. I'm on va.gov. I'm going to pull it up right now. You can take that to your treating provider and ask them to fill it out for you if they believe you have fibromyalgia, and you can submit that with the help of your VSL. It's about a 5-page DBQ. It just goes over when was the diagnosis, do you require continuous medication, are they refractory to therapy, what are your signs and symptoms, headache, fatigue, sleep disturbances, irritable bowel symptoms, etc. It asks for the trigger points to be measured. So they ask for a specific left to right side or both sided trigger points of pain that are present in different areas. Ask how you are affected by this in the workplace, if you are. And that's about it. So please drop some comments if you have any questions related to fibromyalgia as it relates to VA disability. This is a tricky disorder, but the thing that I want to dispel the most is that, you can be evaluated for this in primary care, right? And if your primary care manager is uncomfortable with it, you may ask to get referred to rheumatology. They may or may not oblige. All right. Well, I hope this was helpful, and I'll talk to you guys soon. Thanks for watching.